Hello, I am Dr. Chandakumari, Chief Physician and Founder of Mada Ayurveda Hospitals, Trivandrum. Now I am facing you just to discuss something about Ayurvedic approach for the treatment of diabetic retinopathy. I think the term diabetic retinopathy is very familiar among the even common people, especially the diabetic patients. We cannot say diabetic patients nowadays because we can only say diabetic people. The number of the patients are such a high level. Okay, then everybody know diabetes is not curable totally. And this diabetic retinopathy is a complication of diabetes, one of the major complications. And since diabetes is not curable completely, what about the complication? Why diabetes is not cured? It is considered to be a lifestyle disorder. So it cannot be managed, can be managed but cannot be cured by medicine only. If we need a total cure, we have to change the lifestyle. Then only it can be cured. Now come to our points. Diabetes is not cured with medicine. Then what about its complication, diabetic retinopathy? Then suppose we are curing this retinopathy completely at a time, and if the diabetes is persisting, that means the root cause is still remaining, then the possibility of recurrence is very, very high. That is happening in the case of diabetic retinopathy. So we have to keep in mind that even though once it happens and it is cured, it is treated and cured, and this diabetes is remaining and it is progressing, then no doubt this complication will occur again. So we'll have to, just like this diabetes, we have to manage it with the medicines for a long period. As far as diabetes is remaining, there is chance of complication also. Now let us come to the real point. Nowadays, people searching for treatments for this retinopathy is increasing. Especially I am considering only Ayurvedic line. Because many people are coming to Ayurveda for a second opinion or after a second attack. This retinopathy happens in one eye first. It affects one eye at a time. Usually it happens like that. And they go for medicines and then laser treatments, or in the very serious conditions even surgery will be done. And what happens, in some cases results may be there. Sometimes just like I told before, since diabetes is remaining and it is persisting, this retinopathy also will be progressing, and in many cases their vision will be affected in a serious way. If not treated in time in the correct way, there is possibility of possibility to develop total blindness. So even after a complete treatment for one eye, if their vision is lost, then if it affects in the second eye, they start to think of alternative methods. Anyway, they are not ready to try the same method in the other eye. So they think of other systems or any other remedial measures in any other systems. Then they come to Ayurveda or homeopathy or naturopathy or any other things, whether they can protect the other eye. In the same way, there is another group. After knowing all these things, when they confirm that they are chronic diabetic patients, they assume that there is a chance of development of retinopathy, so they think of preventive methods. That is very, very, very important. These two groups are coming to Ayurveda for the treatment. Now let us consider the first group, that is treatment level. Actually, this retinopathy affects the microvascular system of the eye, especially retina. So, as a symptom or as a complication or in the pathology of diabetes, this retinal vascular system is affected and the vessels are congested and blockages are developed. There will be blocks in the retinal arteries or veins, and so what happens? There will be leakages or hemorrhages in the retina. So this leads to hypoxia, lack of oxygen due to lack of blood supply. And sometimes because of this congestion of vessels, there will be fluid accumulation, and also this hemorrhage, this bleeding, the blood inside will be clotted and will be deposited either in the retina or in the vitreous humor. So there will be blockages and then hemorrhages and then clots, etc., etc. All these changes lead gradually to the degenerative changes in the retina. This is the situation. So what Ayurveda can do? In Ayurveda, we are handling this condition mainly in two steps. In the first step, we are trying to manage the normal blood circulation of the retina. If it is possible, the possibility of accumulation of blood inside in the blood vessels is less and less. So the tendency of leakage or hemorrhage is arrested. So for this, there are very, very effective treatment methods, treatment procedures in Ayurveda. And these procedures are to be done not in the eye but on the head. Shirodhara, that means pouring medicine on the head region continuously for the calculated time. There are different types of Shirodhara, Takradhara, Kashayadhara, Kshiradhara, etc., etc. And these medicines are selected according to the stage of the disease and the nature of the diabetes and the age of the patient and the body nature of the patient, and all these factors are to be considered while selecting the exact medicine for this treatment procedure. And so after that treatments, the blood circulation of the retina can be managed, can be normalized to a very great extent. So the tendency of leakage and hemorrhage will be less. And if there is already hemorrhage, then the medicine will be a little different. We have to arrest the bleeding. For that, this selected medicine will be a little different. In Ayurveda, we will say Raktasthambana, that means to arrest the bleeding tendency. That also is possible by selecting accurate raw materials for these treatment procedures. In the second level, in the second step, we are focusing on the retina. What all damages are already happened in the retina, that is to be corrected. For that, exact ophthalmic medications are necessary. There are highly modified methods in Ayurveda to achieve this result. Aschodana, Netratarpan, Podapaga, and Purambada, Vidala. These are the names of the procedures. And these are to be done in the eye. And these procedures are actually modified in such a way that the maximum level of absorption of medicine is possible through these particular methods. So like that, the damages already happened on the retina can be maintained, can be rearranged to a great extent. Like that, By these two methods, first on the treatment on the head region and second by the ophthalmic medications inside the eye. By these two methods, this problem can be managed, can be treated, and the vision of the people, diabetic retinopathy people, can be protected. And after the treatment also, have to continue some ophthalmic drops or some medicated oil application on the head region and some internal medicines are to be continued. Since why this is to be continued, we know the diabetes is continuing, diabetes is persisting, so we have to protect the eye from the complications. For that we have to keep on maintaining the ocular system normal. By these methods we can protect the vision of a diabetic retinopathy patients. Need not be worried. So keep in mind, try to undergo a preventive measure first. If you are a diabetic patient, don't waste time. Have an approach, have a method to keep your retina or your eye normal and from being affected from this diabetic retinopathy, so that you can keep your vision normal even though you are a diabetic patient. Thus, Ayurveda can help you and Ayurveda can protect your vision. This is shared by Dr. Shantakumari, Chief Physician of Mada Ayurveda Hospital, Trivandrum. Thank you.